Hi, Treasure Valley. It's Katy Connley with Treasure Valley Metabolic Medicine, nurse practitioner and owner. So one of the biggest questions that we get, and what's really important for me to explain to patients, is why we are different. So I obviously treat patients with metabolic processes, abnormalities, obesity, excess fat tissue, excess weight, prediabetes, diabetes, insulin resistance, polycystic ovarian syndrome, hypertension, high cholesterol, all of these things where the root cause is typically excess fat tissue. One of the biggest things that I look for is insulin resistance. This is essentially a process that starts fairly early on in life. It is not uncommon for me to see this in patients that are 17, 18, 19 years old. They're realizing that they're starting to gain weight and they don't really know why, because really their lifestyle, eating habits haven't changed. So what ends up happening typically is that pancreas, because of genetics and a lot of other factors, including our diet and our activity levels, that pancreas starts to kind of work like a little bit harder. So I'm starting to notice in lab work that it's having to churn a little bit harder and produce a little bit more insulin. Unfortunately, what that does is that glucose isn't being burned in the body. The insulin, which pushes glucose into the cell where it's supposed to be, it just gets stored as fat tissue because we're not burning it as energy. So then that fat tissue becomes a little bit more insulin resistant, meaning we need to pump out a little bit more insulin to get that glucose into the cell to be burned as energy or stored as fat. And then that pancreas has to work a little bit harder to produce that insulin. So when we have that diagnosis of insulin resistance or metabolic syndrome, that's basically that pancreas starting to tell us that it's really having to work a little bit harder. Metabolic syndrome is where we're starting to notice other organs starting to suffer a little bit from that process. So that's when blood pressure starts to elevate or increase, and cholesterol starts to increase. And again, the cholesterol is increasing because we're shoving that glucose into the cell and causing it to be stored as fat tissue, which elevates triglyceride levels specifically. So then we start to see that maybe that pancreas is really starting to wear out and those blood sugars are just starting to elevate and they're just hanging around in the bloodstream instead of in the cell where they belong. So that's when we usually get the diagnosis of prediabetes, which again, it's all on this metabolic pathway, which is why I talk about it in kind of this continuum type of way. It's not really clear, cut, and dry, although we do have some markers of when this level is. But again, it's really just this metabolic continuum. So we get prediabetes when those blood sugar on average are at this certain range, and then we get diabetes when that pancreas is wearing out even further. So for us, it's really important to address that issue as early on in the process as we can. So we assess patients for those metabolic abnormalities, especially insulin resistant, right when they come into our visit, because usually patients that have excess fat tissue, obesity, say, hey, what I was doing 10 years ago is not working anymore. Usually that's a sign of insulin resistance. So we address it with laboratory values. We look at it with some medications, either pharmaceutical medications, or I do have some alternative supplements and things like that can be really useful if patients are not interested in pharmaceuticals, or we can go entirely the nutritional and exercise component. It just depends on the patient and where they want to be in that process. A lot of patients want to be really aggressive, understandably. When you've been struggling for maybe your entire life, you really want to get aggressive with this, and that's where we usually get into that pharmaceutical medication type situation. However, again, I'm completely open with anything that patients want to do. I don't want patients to think that they come in and they have to be on a medication, because that's not how it goes. You're in charge of this entire process, and I'm just here to help you with that, and watch other things, the medical process, make sure that blood pressure is improving, all your laboratory values are improving. So if you have any questions and you'd like to schedule an appointment, please give us a call at Treasure Valley Metabolic Medicine at 208-274-9580, or visit us at tvmetabolic.com. Thanks.